dear boys, welcome to my online class. I hope you all are well at your respective houses during this corona pandemic. But we are passing through much crisis time. In this time, it is essential to protect yourself. So, don't go outside, stay at home, and always maintain social distance for your safety. I am Pradipta Kumar, Assistant Professor of Zoology, Cat College. My today's topic is diseases due to hormone and nerve tissue, which is included of chapter 10, and the name of the chapter is coordination. This is my last lesson of this chapter. At the end of this class, you will be able to explain the symptoms and treatment of stroke, explain the causes of paralysis, explain the epilepsy disease, explain the Parkinsons disease. Okay, boys. Now, stroke. A stroke occurs when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and food. Within minutes, brain cells begin to die. It is sometimes called a brain attack disease. Stroke is the second most common disease of mortality worldwide and the third most common cause of disability. Actually, look at this figure. It is artery. Its name is carotid artery. When it is blocked, then brain does not get food or oxygen, so the brain tissue has been damaged. This is called stroke. Look at this figure. This is carotid artery. Look, here is in plaque. So brain tissue does not get oxygen, so the tissue become damaged, or it is called ischemic stroke, or sometimes the artery has been ruptured and so the blood spread all over the brain tissue, so this is called hemorrhagic stroke. Now, symptoms: vomiting tendency occurs in stroke patient, then severe headache, a patient becomes unconscious within a few minutes, shoulder may be hard, pulse rate decreases, face turns red. So it is the symptoms of a stroke patient. Now, causes: high blood pressure, high cholesterol, smoking, diabetes. Whose diabetes not controlled. Uncontrolled diabetic patient occurred by this disease easily. Overweight or obesity. So it is the another cause of stroke. And sedentary lifestyle. Who are idle, who does not work, physical work. So this is the another reason of stroke. Now, diagnosis. There are several different diagnostic tests a doctor can use to determine the type of stroke. This includes physical examination. A doctor will ask about the person's symptoms and medical history. They will check muscle strength, reflexes, sensation, vision, and coordination. So by this physical examination, doctor may be identify the disease. He affected by stroke or not. They may also check blood pressure and examine the blood vessels at the back of the eye. So it is another important cause of stroke. Blood test. A doctor may perform blood tests to determine if there is a high risk of bleeding or blood clots, measuring levels of particular substance in the blood, including clotting factors, and checking whether or not an infection is present. So blood clotting is another reason of stroke. CT scan. A series of X-rays can show hemorrhage, strokes, tumors, and other conditions in the brain. So by CT scan, doctors can be easily identify it is stroke or not. MRI scan. This use radio waves and magnets to create an image of the brain, which a doctor can use to detect damaged brain tissue. Boys, look at this picture. Stroke reveals how to you can stroke. The patient can affected by stroke or not. The 3 steps to stroke recognize easily. Ask the person to smile and stick out tongue. Ask the person to make a complete sentence. I cannot fall tail side with the. And another, ask the person to raise both arms. So look at this picture, boys. This is the first region, and this is the second region. Look, their faces turn one side. I mean, the carve one side of his face, and another region. If doctor asks left up, raise your hands, then he cannot raise their both hands. So it is the another symptoms of stroke patients. So by this, doctors can easily identify he affected by stroke or not. Now, the acronym FAST is way to remember the signs of stroke and can help identify the onset of stroke more quickly. First F means face. Look, their face is slightly carved. A means arm. I mean the stroke patient cannot raise their arms. It will some bend. S means speech. I mean their speech sound not clear. And last T, I mean time. I mean if anybody affected by stroke, then send the patient in the hospital quickly. So it is the acronym of FAST. So these are the symbol of stroke patients. Now treatment: drugs that thin the blood. If any clot remain in artery, in carotid artery, then you can use drugs. Then the blood will be dilute. After that, you can help the surgery. Then surgery that opens the insides of the narrowed neck blood vessels. Where there is a blockage in the neck artery, surgery may be performed to remove the buildup of plaque in order to prevent a future stroke. So it is another treatment. Surgery is another treatment. If any the amount of plaque is more, then the surgery block the plaque in artery or remove the plaque from the artery. Prevention: the best way to prevent a stroke is to address the underlying causes. People can achieve this by making lifestyle changes such as eating a healthful diet, I mean balanced diet, maintaining a moderate weight, so your weight must be controlled, exercising regularly, so you have to be take regular exercise, not smoking. If you habited smoking, then you can leave this habit. So smoking is another cause of stroke, so don't smoke, and avoiding alcohol or only drinking moderately. Paralysis. What is paralysis? Paralysis is the complete loss of muscle function for one or more muscle groups. Paralysis often includes loss of feeling in the affected area. Look, this is a paralysis patient, and he lost their ability to walk. So he always sit down this chair. So this is their muscle is loss of their ability, working ability. So this paralysis. So this is the paralysis patient. Types of paralysis. Paralysis is caused by damage to a neuron. Upper motor neurons convey the message from the brain to the nervous system. When there is damage in a part of the brain, then that receive stimulation muscles lose their activeness. Then the body is paralyzed. Types of symptoms. Different types found in paralysis patient. Look, facial paralysis, their mouth is carved, and jaw paralysis. Jaw paralysis is found in here. Leg paralysis, their leg is paralyzed, they cannot walk. Partial paralysis, their half part of our body is paralyzed, and they cannot lift their body, move their body over one side when affected by paralysis. Arm paralysis, etc. So the paralysis, their left hand or leg, both may be paralyzed. Sign and symptoms. Damage to the right side of the brain, then paralyzed on the left side of the body. If our right side of the brain is damaged, then the paralyzed patient, then our left side will be paralyzed. Damage to the spine. Look, this is spine, I mean spinal cord. If the spine is damaged, then equal side of paralyzed. Our equal side, our both equal side may be paralyzed. And damage to the lower spine, so the lower part of the spine, then paralysis of both legs, so the both legs will be paralyzed if affected in lower spine. Then damage done higher on the spine, the higher spine, then paralysis of all four limbs. So all four limbs, when 2 hands and 2 legs, both will be paralyzed if damage done higher on the spine, I mean upper part of spine, then both arms will be paralyzed. Causes. Generally, a stroke is the cause of paralysis. So stroke is the main causes of paralysis disease. Neck or spinal cord injury or accidents may also be the cause of paralysis. So if your spinal cord will be affected by any kind of accident, then you can fall in paralysis. Nerve disease, damage of spinal cord may also be the cause of paralysis. Paralysis, the treatments and how the treatment work. Paralysis therapy, mobility, range of motion, muscle strength. So the exercise, this will be exercise. So this exercise will be the main treatment of paralysis. Epilepsy, it is a frightening disease, and this disease occurs in our brain, and in many cases the patient becomes unconscious. It is a central nervous disorder in which the nerve cell activity in our brain is disturbed. It is not a contagious disease, it is not a mental illness or a cognitive disability, and the neurological dysfunction seen in epilepsy can begin at birth, childhood, adolescence, or even in adulthood. So epilepsy can be seen in any time, birth time, childhood, adolescence, or in adulthood. Okay, boys, let's watch a video.
Hi, this is Elena. She loves to draw, play dress up with her friends, play with her dog, and oh yeah, she has epilepsy. Oh, what is epilepsy? Well, let's start with the brain. Your brain cells send electrical messages to your body to tell you to move, think, and do things. But when brain cells stop working the way they are supposed to and send too many electrical signals at one time, that's called a seizure. It's like a giant electrical storm. These seizures cause a change in how you see things, how you move, and what you feel. Epilepsy is when a person, like Elena, has one or more seizures over time. Her seizures only last a short while and can look different each time. Here's how it could look when someone is having a seizure. They might stare into space. They may look like they're chewing gum, but they're not. They might be fumbling as if they lost something. They could be wandering around like they are lost. Their whole body might shake. They might say things that don't make any sense. Now that you know what seizures look like, here's what you can do to help someone having a seizure. Stay calm and try to relax. If you have a watch or a phone, try to see how long the seizure lasts. If they fall on the ground, find something soft to rest the person's head on. This protects them from hurting themselves or others. Turn the person on one side so they don't choke. Tell other people around you that this person is having a seizure. Stay with the person until they feel better and ask how you can help. Continue to be calm and cool until the person can answer questions. Be a friend when the seizure is over. If you think you aren't big enough to help, go and find an adult. But wait, there are some things you should never do when someone is having a seizure. Never put anything in the person's mouth, even medicine. Never try to hold the person down. Never leave the person lying on their back. Never make fun of someone who just had a seizure. And remember, epilepsy is an electrical problem in the brain. You can't catch it like a cold, and it doesn't make people like Elena any different from you. Be sure not to make fun of someone with epilepsy. It's not nice, and it's definitely not cool. Having epilepsy is no different than anything else, and your friends shouldn't be treated any differently. If you see anyone being bullied or teased because of their epilepsy, or for any other reason, tell an adult. Always be there for your friend that's being bullied. And now you know all about epilepsy. Thanks to you, kids like Elena will be safer and happier. Let's all take care of each other. This is what being a good friend is all about.
Okay, guys, I hope you got some idea about epilepsy from this video. Water and fire have no direct connection with epilepsy. If the patient falls in water, they may not be able to get up from water on their own and may die by drowning. And for that reason, the epilepsy patient get removed from water and fire place. It is a group of neurological disorders. Causes. The main cause of this disease is not yet known, but some causes occur as the result of brain injury, stroke, brain tumors, infections of the brain, drug use, especially alcohol withdrawal, high fever, especially in infants, complication of diabetes or pregnancy. These are the main causes of epilepsy disease. Now, another disease, Parkinson's disease. Parkinson's disease is named after James Parkinson, who in 1817 wrote a classic shaking palsy, a disease for which the reason is still unknown. So, the scientists have not identified why Parkinson's disease occurred in our body. It is unknown reason. It is a condition of the brain that causes jerking of the hands and legs. So the Parkinson's disease, who have Parkinson's disease, their hands and legs are always jerking. The patient becomes unable to walk and move. For that reason, patient does not move easily. The famous internationally known boxer Mr. Muhammad Ali suffered from the disease. So you know the name of Muhammad Ali. He is a famous boxer. He affected by this disease, Parkinson's disease. Incidence occurs in the age group of 60s. I mean, above 50 or 60s, this disease can be affected in your body, in your brain. Mostly men are affected than women. So men are affected by the disease than women. Actually, one kind of liquid substance that's name is dopamine, which is produced in nerve cell in our body. But by this disease, the dopamine secrets reduced. For that reason, the hands muscles are jerking always. So the lack of dopamine, the disease occurred. Causes. Generally, the disease starts after the age of 50 years or above. But in exceptional cases, young people may suffer from this disease. In this case, it is usually hereditary. Actually, young people also affected by disease. If their family member is affected with this disease, so they can also affect this disease. So it is also a hereditary disease. Nerve cells produce a substance called dopamine. So dopamine is the main causes of the disease, which helps in muscular movement. Due to Parkinson's disease, dopamine producing cells are gradually destroyed. Without dopamine, nerve cell becomes unable to send stimulation to the muscles. So the muscle loses its effectiveness. With the increasing of age, muscles of Parkinson's disease patient becomes more inactive, so the patient's movement difficult. Stages of Parkinson's disease. Look, stage 1, mild symptoms, tremors on one side and postural changes are observed. Stage 2, moderate symptoms with facial modifications. Tremors on both sides of the body is observed. So at this stage, both sides is observed. Stage 3, progression of disease is occurred. Imbalance of body and improper reflexes are observed. So imbalance and improper reflections are observed in this stage. Stage 4, drastic change is observed. Personal assistance is required even in simple tasks. And last stage, stage 5, advanced stage with aggressive symptoms. Hallucination and spasms occurs in this stage. Look, this is the stage of Parkinson's disease. Parkinson's disease. First time there are only simple symptoms will offer here. Their arms is a problem. Then the second stage they carve, their body is carved. Then third time they do not stand by normally. Then fourth stage they lost their movement, and last stage they fully lost their movement. Okay, boys, have any questions? If you have any question, any query, then ask me through SMS. Now, a sample question. First question: what is the main cause of Parkinson's disease? Dopamine, less insulin, lack of iodine, malnutrition. The correct answer is dopamine. Number 2, in case of epilepsy, patient becomes convulsion, brain hemorrhage, drawn to death. Which one is correct? 1 and 2, 1 and 3, 2 and 3, 1, 2 and 3. The correct answer is B, 1 and 3. Number 3, what is called the loss of sensation and motion in a part of the body? Paralysis, stroke, epilepsy, diabetes. The correct answer is A, paralysis. Number 4, the causes of paralysis are stroke, nerve disease, damage of spinal cord. Which one is correct? 1 and 2, 1 and 3, 2 and 3, 1, 2 and 3. The correct answer is D, 1, 2 and 3. Now your homework. First question, what is paralysis? Number B, why the epilepsy patient falls in water, they may not be able to get up from water. Explain. Number C, explain the A-mark disease. A means brain disease and also known as fattening disease. So you have to analyze, explain the A-mark disease. Number D, the person who affected by B-mark disease will face problem in his future life. Analyze this statement. Number B means dopamine producing cells are destroyed. So in this case, in this disease, dopamine producing cells are destroyed. So at first we have to write down the name of this disease, then you have to analyze the disease. Okay, boys, I want to say again, don't go outside, stay at home and stay safe. Thank you, boys, and see you in my next class.